Another update on methylene blue for everybody. I've talked a lot about it. One of the things that I mention periodically is it's a hormetic drug. It has a hormesis quality to it. What that means is at low doses, it can be beneficial. At high doses, it can be toxic. There's a bell curve to it. Low doses, it's beneficial. As that's increased, then suddenly we get to a toxic dose. So we always caution people, and most of my recommendation is let's start low and increase it slowly until we see some benefit. We recently had a question through our social media sites about where's the line in the sand? What is a low dose? What's a high dose? What's the caution? What's the reason that we don't want to get the dose too high? So I'd like to address that. I thought it was a great question because we can say that low dose it's good, high dose it's bad, but what does that mean? What does that really mean? So we're going to talk about that generally, and the thing that we see methylene blue used the most for and have the most positive feedback is cognitive function. Quality of brain, thoughts, foggy brain, foggy thoughts, early onset dementia, those types of things. So in cognitive function, research is starting to talk about dosages of 4 milligrams a day, 4 milligrams twice a day, up to 16, maybe 30 milligrams a day. And if you consider what methylene, the NeuroPro Plus, which is our #1 product, there's 15 milligrams in a tablet. So it's really in that dosage range, 1 or 2 tablets a day, 15 to 30. You're staying in that low dose range where there may be some benefit. Using weight as a guidance in a milligram per kilogram of body weight, it tells us that toxic doses higher than 5 to 7 milligrams per kilogram is where we have to use some caution. So at 5 milligrams per kilogram, if a person weighs 200 pounds, 400 milligrams is toxic. So 150 pounds, 300 milligrams is toxic. But my experience is we never see anybody at 100 milligrams, which might be beneficial for an individual. That's why I think it's important. Let's start low. Let's increase it gradually. Every 2 weeks, we'll guide you through that. If you're interested, you need to reach out to us. And what are some of the adverse effects if you get too much? Serotonin syndrome is really probably the thing that you'll notice the most. And that's sometimes if people are taking a serotonin support medication for depression. Fluoxetine, Prozac, those types of drugs are called SSRIs, serotonin reuptake inhibitors. If you inhibit the reuptake of serotonin and methylene blue supports your production of serotonin and you get too much, it's called a serotonin syndrome. Your symptoms actually get worse. So if you're using a medication for things like depression, anxiety, your symptoms will get worse if you have a serotonin syndrome. So again, let's start low, let's increase it every couple of weeks, and let's be smart about it. If you have symptoms that suddenly seem to escalate, you need to really stop it or back off. Cardiac effects, I think it's something to consider: an increased heart rate, increase in arrhythmias, if you're getting too much, decrease in cardiac output. The heart doesn't work as efficiently. Now, we're probably not going to see that until we get into that pretty high dose, so never go there. Never go to that 200, 400 milligram dose. It just doesn't make any sense. And the literature and the science and the research really point that out. So I love the question. I love the opportunity to answer it. These are really dosages that are coming to the forefront. And I think these products really answer the dosing ranges for us, and how we're recommending it keeps us within those healthy ranges.